Hello everyone, welcome to AY Tutorials. Today we are going to see non-steroidal anti-inflammatory drugs. Introduction. NSAIDs, drugs with analgesic, antipyretic and anti-inflammatory properties. So this NSAIDs is having three most important properties, that is analgesic, antipyretic and anti-inflammatory properties. Distinction from steroidal anti-inflammatory drugs. There are two types of drugs, steroidal and non-steroidal. Steroidal means glucocorticoids, and in non-steroidal, it is prostaglandins and leukotrienes. So these drugs are used to treat pain and inflammation, but they are not having any steroidal moiety, and therefore they are known as non-steroidal anti-inflammatory drugs. These drugs are having three main properties, that is, as I have mentioned, analgesic, antipyretic and anti-inflammatory properties. It shows analgesic action by reversible blocking of pain, then antipyretic by lowering body temperature, and anti-inflammatory by reducing or treating the conditions that increases the inflammation. All these things usually occurs because there must be some physiological changes that are occurring in the body. Classification. Non-selective COX inhibitors, in that salicylates, aspirin, propionic acid derivatives, ibuprofen, naproxen, ketoprofen and flurbiprofen. Phenamates, in that mefenamic acid. Then enolic acid derivatives, pyroxicam and tenoxicam. Then acetic acid derivatives, ketorolac, indomethacin and nabumetazone. Then pyrazolone derivatives, phenylbutazone and oxyphenbutazone. Then second class is preferential COX-2 inhibitors, in that nimesulide, diclofenac, aciclofenac, meloxicam and etodolac. Then selective COX-2 inhibitors, in that celecoxib, etoricoxib and parecoxib. Then third class is analgesic antipyretic with poor anti-inflammatory action, in that para-aminophenol derivatives, paracetamol, that is acetaminophen. Then parazolone derivatives, metamizole and propifenazole. Then benzoxazosine derivatives, nefopam. Here I have mentioned how prostaglandins, thromboxanes and leukotrienes are formed. Phospholipid, with the help of phospholipase, it produces arachidonic acid. Arachidonic acid, with the help of cyclooxygenase and dioxygenase, it produces prostaglandin G2. Prostaglandin G2, with the help of prostaglandin endoperoxide synthetase, it produces prostaglandin H2. Here prostaglandin H2, with the help of lipooxygenase, it produces leukotrienes. With the help of prostacyclin synthetase, it produces prostacyclin. With the help of thromboxane synthetase, it produces thromboxanes. And with the help of isomerase, it produces prostaglandin E2 and prostaglandin F2 alpha. Prostaglandin E2 is the analog of dinoprostone, and prostaglandin F2 alpha is the analog of dinoprost. Mechanism of action. Cyclooxygenase. Cyclooxygenase is responsible for the pain and inflammation by producing prostaglandins, which are the chemical messengers that are contribute to the inflammation response. Then there are mainly actually three types of COX, that is cyclooxygenase. Here I have mentioned only two, COX-1 and COX-2, which are studied in this chapter. So COX-1 is constitutive and it is involved in the physiological functions, for example gastric mucosa protection and platelet aggregation, whereas COX-2 is inducible and primarily involved in inflammation and pain. Here COX-2 is induced by oxidative stress, ischemia, injury and participated in inflammation. Reduced synthesis of prostaglandins, thromboxane and prostacyclin. COX-3 is also there, which is isolated from the cerebral cortex and not involved in inflammation. It is involved in temperature regulation, so paracetamol is effects on it. Pharmacological actions. Analgesic effect. It is having some peripheral and central effects and used to treat mild to moderate pain, that is in case of headache, musculoskeletal pain and dysmenorrhea. Dysmenorrhea is nothing but the menstrual cramps, and as we know that mefenamic acid is used in the menstrual cramp. Antipyretic effect, reduction of prostaglandin E2 in the hypothalamus, and uses fever reduction. Because of reduction in the prostaglandin E2 in the hypothalamus, it reduces the fever. Anti-inflammatory effects, inhibition of prostaglandin synthesis and reduced inflammation mediators. Uses rheumatoid arthritis, osteoarthritis and other inflammatory conditions. Rheumatoid arthritis and osteoarthritis, these are the two type of arthritis. In rheumatoid arthritis, the person's immune system attacks on the joints, and in case of osteoarthritis it occurs because of the overuse of joints. Antiplatelet effect, aspirin, mechanism, inhibition of thromboxane A2 synthesis and uses prevention of thromboembolic events. As we know that aspirin used as an anticoagulant, so it is mentioned here that by the inhibition of thromboxane A2 synthesis, it helps to prevent thromboembolic events. Pharmacokinetics, absorption, oral absorption is generally good, as we know that NSAIDs are taken orally. Distribution by protein binding, then metabolism, hepatic metabolism is there, then in case of excretion, renal excretion is there, and there are certain factors which affects on the pharmacokinetics. Adverse effects, gastrointestinal effects, it includes dyspepsia, gastritis, peptic ulcers and bleeding by the mechanism of COX-1 inhibition. Then renal effects, sodium and water retention and renal insufficiency. So here, because of this side effect, we are not going to given any NSAIDs to the renal failure patients, and it occurs by the mechanism of reduced renal prostaglandin synthesis. Then cardiovascular effects, that is all the coxib comes under this category. They increases the risk of thrombotic events, that is in case of myocardial infarction and stroke. So celecoxib, paracoxib and aciclocoxib, these three drugs comes under this coxib category, and they are having a serious side effect of stroke or myocardial infarction. Then hypersensitivity reactions, it includes asthma, urticaria and angioedema. Specific NSAIDs examples, aspirin, it is having unique antiplatelet effect. Rett syndrome is the side effect of aspirin in case of children. See, if aspirin, if it is given in a larger doses in children's, then serum transaminase increases in the liver, which causes liver damage, and it is known as Rett syndrome. Ibuprofen, it is commonly used for pain and fever and which is relatively safe. Diclofenac, it is having a potent anti-inflammatory property, but there is the risk of hepatotoxicity. Celecoxib, it is selective COX-2 inhibitor. It lowers the risk of GI effects, but it is increased in cardiovascular risk. Therapeutic uses, pain management, headache, musculoskeletal pain and dysmenorrhea, fever reduction, anti-inflammatory conditions, rheumatoid arthritis and osteoarthritis, prevention of thromboembolic events. Low dose of aspirin is used here, and there are some other uses also. Contraindications and precautions. NSAIDs are contraindicated in peptic ulcer diseases, renal impairment, pregnancy, especially third trimester, hypersensitivity to the NSAIDs, cardiovascular disease for coxibs, and children with viral infections for aspirin. Drug interactions with anticoagulants, especially with the warfarin, then antiplatelet drugs, corticosteroids, antihypertensive drugs, and other NSAIDs. Here I have forgot to mention one most important use of NSAID is that they are used in the closure of patent ductus arterius, which is stimulated by the administration of prostaglandin synthesis inhibitors like indomethacin or aspirin, which is effective in the premature infants. Indomethacin with the dose of 0.1 milligram per kg body weight It is administered orally at 8-hour intervals. Here we have concluded the topic of NSAIDs, that is non-steroidal anti-inflammatory drugs. Thanks for watching.